So I think we're recording now, so we'll just make a start. I really appreciate you being okay with the recording the session, because I know that scheduling these things is really tricky, and sometimes students have made extensive plans before they hear that I offer these sessions. So it's a great thing that you're willing to let me capture this and share it with the rest of the class. So it's been quite a busy semester so far, but we have reached the halfway point of the semester. You are close to, it's not quite one-to-one, but close to being half done with the workload and with the material that we're covering, and so on and so on. I know that we have completed one exam and we have two coming up, but if you count the amount of coursework and stuff and number of chapters, I think we're close to the midpoint. So you should be very, very pleased and proud with yourself for having gotten that far. This week, we've been kind of wrapping up what we started last week with looking at cartilages and bone tissue in general. This week, our focus has been more fiercely on the actual skeleton and the actual bones. And there's a lot to cover there. I completely realize that it might be a chapter that sometimes students feel like I'm throwing just a lot of stuff at you. And it is a little bit more heavily leaning towards the anatomy side of things, because I'm going to be honest, there's no other great way of teaching or learning the bones and different bone markings than simply through process of memorization. So as much as I would love to be able to just transfer you with some sort of a golden solution to that, in reality, a lot of that is just memorization. And it is worth doing the workload now, because you will see in your later studies that a lot of the terminology that we will use in even other systems, especially I'm thinking of the coming chapters on the muscular system, is based on the vocabulary that you learned with the skeletal system. So really putting in that effort now is going to be worth the while. So I guess that's my little encouragement for you, that keep going. Do remember that I'm all about encouraging you for taking notes as well. So this is really the time for you to find a way how it is best for you to record the details, so that you're able to find the information if something comes up. There's a bone that you're a little unfamiliar. We will cover the important ones, but I want you to use all tools that are available. And I've uploaded on our Canvas course various different kinds of diagrams. I was recently talking with a colleague, so even though I say always that I'm a subject matter expert, I do a lot of training, and I do have some amount of training on how to teach. So it's not that you're just at the mercy of a person who just knows the body really well. There is a theory that you learn things when you've heard it or you've been exposed to the material 3 times. So that's why in these classes, I try to do visual, I try to do auditory, and I try to encourage you to take those notes. If you do all those 3 steps and you still don't remember the material, then please, please, please let me know. It might be that we need to explore what other ways we have to help you to remember the material. We'll finish off this week's material by having a quick look on joints, and I mean by articulations. I don't think that it's a problem in this class, but sometimes I have to clarify that to the students. So we'll have a look of not just bones, but how bones join to other bones. So it's not as big of a chapter in terms of the amount of material, but I think it kind of nicely wraps up everything that we're talking about. And just real quickly, you should be seeing my PowerPoint. I should be sharing it. If for some reason you're not seeing it, just give me a shout out. Here's what I had a plan for today. I know that most of you probably come here for that condensed mini lecture, and I absolutely want to make time for that. But I do also kind of want to get a pulse of what's going well, and so on. We have completed our first exam. We have completed our first practical. And literally the format is going to be the same for the coming exams and coming practicals. So at this point, you know whether it's working for you, or if it's not working for you, it is a good idea that we spend that time figuring out how to make it to work for you. I have also asked you this week, and I think it's an actual assessment element that I put into our grade distribution for you to provide me feedback. Because even though I want to create these spaces where we can talk, and I also ask you to always just message me, I'm pretty responsive, even through Canvas messages. I think sometimes it's hard for students to share honest feedback. And that's why I try to give this also a way to give through an anonymous form a chance to give me feedback. So I want to touch upon that a little bit and talk about what I've already received and how I'm utilizing the feedback that I've received. Like I said, it's a two-way dialogue. So I never want it to be just me dictating what this class is. We'll have a quick look of what's planned for this week, and we'll focus on reviewing the chapter content. If there is interest, I'm very happy to go through, and that should obviously say there. This is my bad. It should say the same chapters for the homework review, if there's interest for that. But I genuinely think that most of the time students feel comfortable once they've gotten the chapter review. And any other questions? If at any time you have comments, you have questions, don't feel you have to wait to the end. Just jump in either by unmuting yourself and shouting out that, hey, I've got something, or dropping it to the chat. Sometimes it's hard for me to see the chat, but I'm doing my best, and that's why I'm sharing with you, not actual presentation, but I'm sharing it as a view from the computer where I'm looking at the slides so that I can monitor all of the other things that are going on. So I guess that my first thing, and especially my face-to-face students know that I'm very, very big on self-care and students learning those skills and practicing those skills, and also forming a sense of community. It is harder to do in an online setting, but I want to dedicate just a few moments for, if you have any thoughts from how far we've gotten, whether it's about the exam, whether it's about the practical, whether it's about the course, or if you don't even want to talk about the course, just how are you doing today? And there's no pressure to share, but if you have something, we're in my face-to-face class. The class is big about celebrating successes. So if someone has something great happening, we normally throw a party to celebrate that. So feel free. But like I said, there's no pressure. I'm going to try to lead by an example, and I'm going to share with you guys that I normally work during the week in Phoenix, but I just got to my house, which is a little bit more rural. So I got to spend some time before our class. That's why I posted the link a little later with all of my farm animals. So that's going well today. I'm very, very pleased of that. If anyone has anything or any questions or anything they want to share, this is a good space for it, but I won't also take too long, but feel free to do so. Sounds a little quiet, and that's okay
I like
as
the way
well.
that the class is structured so far. I think it's been helpful having these sessions, and I like that we can go back and do the practice anatomies over, and I like the handouts. I'm really big on the handouts.
Thank you so much. Hey, that helps me a lot because I have been doing this for so many, many, many years that I have all kinds of materials, but I don't always know what to share. So now that I know, I'll make sure to keep sharing more of
No,
those.
I
So
like
thank
that
you
there's
so
a
much.
variety. It's very helpful.
Excellent. Thank you so much for sharing that. Well, in that case, I'm just going to move on. But if something comes later on as well, feel free to share. But I really appreciate that you were willing to share. I'm going to skip over the next one. But like I said, we've been doing a little bit of midterm feedback. So I asked students to fill in this anonymous survey, and you'll find it on your learning modules. I think it's the learning module right before this week's module. So right before module 4A and 4B, there's a module that's called midterm feedback. And you literally just click on that link. It opens Google Forms. I will not see who filled in what, and I would never even check for that. I will collect email addresses in case there's a struggle that a student has hard time sending me a confirmation that they continued or completed that survey. So I ask that you complete the survey. It's not a long one. And when you finish it, it will give you kind of a confirmation screen. So then you just take a screenshot of it, or some of my students even use their phones or whatever to just grab a picture of that and upload it as an assignment to that element that's right underneath that link. That way I can quickly award you points. But I realize that things happen and sometimes students don't capture that. So if you miss out on that, you just go to that assignment still and you type in the date and time when you completed it. And then I can pull up that you've completed it. That's why I'm collecting the email addresses. But it is completely anonymous, and I'm totally comfortable to hear both good and bad. I do have to say, is because sometimes students get confused. All of these do get shared with my bosses as well as part of my evaluation process and my contract renewal process. So I would advise keeping in mind that with the way things are phrased, you are free and welcome to share your honest feedback. But I also would appreciate it if you keep in mind that it does go to the big shots and big bosses. So I've already received some of the feedback. There's still time. You only have to have it done by the end of the week to get the points. But so there's still time to send more feedback, but I've received some, and I wanted to show that I'm not just collecting it. I actually want to act on it. So I do care. Before I do that, I do want to be totally transparent with you and share with you the real deal. And I think I quickly addressed that on the first week when we met, but I didn't really talk about it a lot. This is a class that I was not meant to be teaching. Or this course. I was asked with less than a week of notice that would I be willing to teach it, and I was very, very glad to teach it. I've taught BIO201 in other institutions for many, 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 many years. So you might see that there's a little bit of different branding that I've used in some of the materials for that reason. But I realize, and I'm upfront and honest with you guys, that I don't think it's the perfect course, but it's not also a course that would have been just thrown together. I have been doing this for a long time, and I had elements I was able to pull from. But because it's not a course that I had more than a week to develop, and I wanted to make sure that you have access to all of the material on day one, I realized that there's changes that need to happen as well, that it's not perfect. So for that reason, these feedbacks, I want to make sure that I react to them even during the semester. So having a look of some of the comments that I've heard that people are finding on average it useful to have communication, useful to find those announcements. I know that I do a lot of announcements, and you can just literally block if they're coming to your email and you're upset about that. You go and change the setting when announcements get sent from your Canvas settings. You can do it like as a one weekly summary of announcements, or you can have each one to come. But I know I do a little more announcements that I would do in my face-to-face classes, but I think it's really, really important that we have that communication going on. You're not here alone on this class. I definitely am invested, and I promise to you guys that if you are putting in the effort, I will put in the effort as well. I really do want you to succeed and meet all of your goals for this class. I'm also hearing a little bit of feedback that students are quite happy with the interactive element of the text, what the textbook publisher has prepared for us for the Connect. It's not that I just took a textbook and threw it on there. It is carefully curated. So I'm glad if it's working and it's helping you. So we're going to keep doing it if it's working out well. I'm also hearing some feedback about the setup and structure of the course, the chance to progress at your own pace, and the materials being available and these live online options. Again, I am a student myself at the same time as you're taking this class. I think every good teacher should be going to school a little bit themselves. I'm working on my doctorate, so I realize that we all have many competing needs. So I want to be respectful of that. And that's why I think it's so important that you can predict what happens from one week to another. The structure is very, very predictable. So I do offer a lot of materials and I offer a lot of options. So use what works for you. Having said that, I do hear that there are students who feel like they want to dig in further and they want to do more. And I will try to help you always. And I don't think that this is really relevant to the students who are now present in this session, but I'm saying it for the recording at the large. The reality of the life is that these online courses, there is an element of being self-driven. If you want to go above and beyond, I will always help you, but you also have a great amount of resources through the textbook, through the other materials that you can access interactively through the publisher's page, through making your own notes. So I'm all about providing what I have, but the reality is I taught for many, many, many years in university, and I still occasionally do. Really, in an ideal world, the expectation would be that I wouldn't share any notes with you guys. So I'm sharing more, but do also consider that there's an element that you have to do things yourself. So this is where we get to the things where I can do differently. And I appreciate all feedback, but sometimes I have a hard time putting it together because I'm trying to make sure that everyone's having a good course. So I did get some questions or some comments from some students that they felt that some of the material, especially the PowerPoints, especially the videos, felt repetitive. They were asking for more condensed material than the recordings that I provide, or even, and I don't think that this is a really fair word, but I'm just using a quotation directly, more dumbed down versions. So kind of more of a like just the key points version. So I hear you. And I can understand that. If you're looking for that, I really recommend looking at the key headings, looking at the key things on your textbook. I got also some comments from the students who wanted the exact opposite. They wanted a longer lectures. They wanted more materials, go to the deeper understanding. Again, I would love to do that. I do think that there is an element of doing that a little bit independently. I try to find the middle that works for the most, and I know that sometimes I miss some students on both ends, but if you want to go further, I encourage you to be proactive about it, and I've taken some steps to provide you additional resources to do so. I also got not a lot of comments, but I think one or two about the technical issues that they were having hard time zooming on the quizzes, exams, on the assignments. So I'm not quite sure what that question means or that comment was, but I'm doing my best to understand what I think it is. So do remember that you are able to zoom in and out on a web page on the browser. So get familiar with the browser that you're using. If it is a Canvas related, just use the browser's ability to zoom in and out of the website. If you're doing the assignments on a mobile phone or on a Padlet, I can understand why this would become an issue. But then my answer would be that probably you should do them on a laptop or PC. That's what we recommend, and that's what we ask on the syllabus. In addition, if they are kind of struggles that anyone's having relating to the homework, I really refer you back to the Connects its support section. So there are certain system requirements that the course material is optimized for. So again, check those, try to work from those. If you need, our college is more than happy to loan you a laptop for the full semester. You just go to a library and ask from them, and they will be able to help you. You get to keep the same laptop for the full semester. Then you check it back in, and you can check it out again at the beginning of the next semester. You also have an option through the Connect's support pages to check the settings of your computer. Is it compatible for the course material? So those were some of the biggest things. And the last thing that I heard was that some students were asking for even more material, especially in a shape of a study guide. Again, I had never heard of a study guide until I came to America. In the rest of the world, the approach is that everything I teach is a study guide. So I've gone and I've prepared something, but I really think that those learning outcomes, those anatomy lists that I provide at the beginning of each module could be a good place to start. So use them. You might have to be a little bit more proactive. I also heard some questions of people wanting to dig in deeper, have discussions. So I've implemented those changes. And let me share my other screen with you really quickly to show you what's on my mind and what I mean by that. So here we are on a Canvas course, and I'm just going to jump into the same view that you would have so that it looks more uniform. And let's go, for example, for this week's learning module. So here we're seeing the midterm feedback, like I said, that you would complete. And the first module that we had for this week was week 4A. So now for those students who wanted more, I did have already some handouts, but I've also uploaded further study guides there. I don't have a study guide for everything, but for things that I had study guides, I've uploaded those in response to those requests. I also had students who asked to have a space and a chance to discuss about the chapter material. So I've created discussion forum for every chapter. It is not required for you to take part, but if questions come up, if realizations come up, if good stories come up, feel free to share them. I'll try to pop in and monitor those, but in all reality, I also encourage kind of peer support. So if you have a question, someone else in the class might have an answer. So I try to give a little bit of time that someone else has a chance to jump in if something comes up. But I'll be monitoring those and I'll be helping. I also did have those overachiever students who wanted to do more and wanted more homework and wanted more assignments, which I was a little surprised. So I will not add more homework for you in the middle of the semester as a required activity. However, I provide an option for those students who want to do more, but that's not required. There's no points associated with additional work. So I provide for every chapter a little new page, want to dig in deeper to the material, which really provides that study guide element of the key concepts, both in verbal narration, but also as a bullet points. What are the things you should take away from this week's material or this chapter's material? So I hope that that's helpful. In addition, I have some kind of a bigger questions for those students who want to dig in deeper. You're welcome to think about them, or you're welcome to write about them, and then send your answer to me, or write about them on the discussion forums, or we can talk about them on these live online sessions. I've also provided you a lot of reading that's related to that particular chapter if you really want to do additional study yourself. So I've gotten you some good resources. Most of them you can find just by Googling the links, the headings that I've given to you. And if it's hard to find, I've also provided a hyperlink to access that material. And those students who wanted extra work, I have two types of assignments for you. I have critical thinking questions and I have clinical application questions. So again, you can do that work. And if you do that work and you submitted it to me, I will grade it and I will provide feedback, and I will also provide you an example answer. I won't do it automatically because really if you want to do more, you have to put in a little effort before I start doing more. So that's why I'm waiting for the student to reach out to me. The clinical application questions are really applying a kind of more of a pathological questions and topic material for any student who wants to dig in those. So those are available for you. They're not required. But I have made one for every single chapter that we cover. So if you were to do that, you could literally upload it as a submission for me, and I would then look through it and I would provide you feedback. So there's no reason why you should feel that you're not getting a chance to dig in deeper. So I hope that that helps with that request. So let me just come back to the view that I wanted to go really quickly. That looks better. So like I said, I've provided a bunch of new stuff. The new stuff is not required. It's there to help you if that's something that you feel that would benefit you. If anyone has any questions at this point, feel free to jump in. Otherwise, I'll just keep going because I want to make sure that we get to the actual chapter material as well.
I have a question.
Sorry, go ahead.
For memorizing the different bones and just structures, for someone who's more visual, do you recommend like those coloring books or like just printing out all of the different, because I saw the study guide where you wrote all the different like bones and different things that we need to know. Do you recommend anything over something else or just kind
That's a
of?
really good question. And in all honesty, it is so individual. When I studied skeleton back in the day, I did go, and you have this option. Please know that even if you're studying online, you can go to the campus, and every campus that we have has a learning center. At Pecos campus, it's at the upstairs, one floor up from the ground floor at the library, and they will have skeletons there for you, and you can use them. But if that doesn't work with your schedules, you can then use this. I think that what I've offered here, the bones of the body, is one of the best resources that I would use. I provide a blank version, and then I provide one that's completed, so you can kind of do your own cheat sheet. So that's what I
I
would
printed that. I must have missed the blank version.
Let me make sure. I'll upload a blank one if it's not there, but let me make sure that it is there. I really think if you do the process of writing it down, you will never forget it. And
Yeah.
especially coloring. I would do that as I'm going through the material. If I have for some reason failed to upload the blank one, I will do it immediately after this session.
Okay, thank you so much.
Of course, and I will have same stuff coming up for the muscles as well, because I know those are just a lot. Like I would love to say that I'm going to tell you a story and you'll remember it, but there's just no other way. That's
Yeah, I feel like at this point, because I've taken this class, but it was just 10 years ago. So I feel like at this point, it's just memorization. Thank you.
Perfect. Hey, I love that question. That was probably a question that I can guarantee you that 10 others were having. So thank you for asking it. So having a look of what I'm asking for you to do for this week, it's literally just the chapter 8 and chapter 9. I have a quiz and practice anatomy for each one of those. And then I have one more, food for thought, which is really kind of relating to that joint chapter. I wanted to expand that chapter a little bit. So you've done those in the past. So those are what I'm asking you to do. In addition, I'm asking you to do the midterm feedback. I would appreciate if you do it, but if you really hate to do it and you're just going to write horrible things, then you, of course, have an option not to do it. But if it's constructive or if it's positive, or even if it's not positive, but it is something that I can change, I definitely will appreciate it, and I will do those changes. Any other questions? Any other comments? If it's okay, I'm just going to move on to the summary of the chapter material, just because I know that you have other places to be and things to do, and I want to make sure that I provide that as well. We can do more questions at the end if anything comes up. So For this, I'm gonna make my screen full-sized, just because I think that students find it easier to follow along. If for some reason you are not seeing at your end a full-sized screen of PowerPoint that says review of chapter 8, please let me know. Otherwise, I'll just keep going. So, what we're doing this week is really looking at the human skeleton. Skeleton comes from the Greek word for skeletos. I'm not a Greek, I don't know how to pronounce it, but really it refers to something that's dried up. I have a degree in fine arts. We actually did use, back in the day, a mummy or a paint pigment that was made of mummies. So skeleton really refers that it's the dry part that's not going to decay of the body. We do have to remember that there are so many different kinds of skeletons, though, available. So that sometimes surprises students, and they're kind of taken back that there's so much more that we can look at and we can talk about. I won't go into that. We're focusing on the human skeleton, but there are other adaptations that other animals have, like the exoskeleton, which bugs have. Their bones are outside their body. Hydroskeleton, earthworms, for example, keep their structure thanks to the fluids inside their body. And of course, on a cell level, cytoskeleton, you're already familiar with that. So we're going to start by looking at the axial skeleton. Axial skeleton is made of about 80, or not just about, it is made of 80 different bones. We will focus on the most important ones, and really this is going to cover the skull, the vertebral column, and thoracic cage. So often how I describe that to my students is to think of it that a human body is almost like a cylinder. And all the important stuff is housed within that cylinder. In addition to that, we have appendixes. So we have our upper limbs and lower limbs, but you can live without them. You can't live without the structures that are within the axial skeleton for the most part. So kind of to summarize, why does this matter? Axial skeleton forms the longitudinal axis of the body. So if you wanted to think about it as this kind of a tube, cone-like structure that we have where the vital organs are housed. In addition, axial skeleton is where a lot of other stuff in our body hangs on. So it's attachment points, support points for major muscles, carrying our head, neck, trunk. So a lot of things are attached to this body part. Like I said, this also forms the axial skeleton protective structures around the vital organs. Brain is housed within the skull, so nicely protected there. Spinal cord is housed within the vertebral column, and of course our heart, lungs within our thorax. So there's a lot of protection around the things that are really, really vital for our survival. And I don't know, that was an illustration that I felt that I needed to do for some reason. So if we're starting with the skull, we will see that skull can be divided into two major parts, the cranium and the facial bones. There's going to be 22 bones in total, but I think it's easier to kind of summarize it through that. And how I often explain it to my students that the facial bones are really the anterior portion of your face, and then cranium forms the rest. So cranial bones enclose the brain and the cranial cavity inside them, and really is an attachment point for many bones of the head and neck. Facial bones instead form the framework for the face and kind of contains many special organs for sight, smell, taste, things like that. Also the important passageways for the air, food through various different kinds of openings. And I can't not mention it. Obviously, the muscles of facial expression, which is really important for our communication. So let's look at the cranial bones really quickly. I've listed them there. And again, if I do not have a blank version of this diagram, I will totally upload it there. Again, I think it's easier to learn them if you color. I'm a visual learner, so I do that. But if you have a different way of learning, you do something different. You can do really good deals with Halloween supplies. They might not be always completely accurate, but you can even buy them around the year through Amazon, through other web stores for really cheap prices. And then you can draw on those, for example, different bones. That's educational and fun. So, kind of continuing on the whole theme of the cranium. Cranium itself often is divided into two parts: the vault, which is really the superior, lateral, and posterior, and also the forehead portion, whereas the base really forms the inferior portion of the cranium. Notice how cranium has many openings in it. In fact, 85 different holes that you can find at the base. I'm not asking you to learn all of them, but the most important ones would be good ones, like, for example, the foramen magnum, which literally in Latin means the big hole through which the spinal cord and brainstem travels. These openings really are for things like your ears, so that you have access to the outer ear through nasal structures, so you can see how the olfactory nerves go through those little holes at the nasal region. There's openings at the orbit regions, but also for many important cranial nerves coming from the brain. So they're often called with different names: foramina, canals, fissures, depending on which one we're talking about. Kind of continuing onwards within the skull, I do want you to be comfortable with the different sutures. So sutures are where the bones that form the skull join together, and there's going to be four major ones. So coronal suture joins the frontal bone and the parietal bone. Remember coronal plane. I often tell my students, think of the coronal plane. That's where your hands would be if you put a crown on yourself. So following this line between the frontal bone and parietal bones. Sagittal suture separates the skull to the left and right, separates the two parietal bones. So that's the important midline there. Lambdoid suture is really what separates at the back of the skull, the occipital bone, and then you have also your squamous or scamosal sutures that you will be able to find. Continuing onwards, in terms of the facial bones, there's a lot to go through there. Really, I think that the most important ones, obviously, you'll end up seeing that you have a bunch to cover there, but really just memorization. There's a lot of symmetry. So if you learn half of the face, you should be doing good. If you want full story of each bone, I recommend that recording that I've done for you. I'm just, for the interest of time, gonna keep moving onwards. I think that the big ones from the facial bones, like I said, the mandible, will have a look of that a little bit, that U-shaped bone where you find the chin, for example, the maxillary bones just above the jaw, kind of majority of the face that you can see on yellow here. Zygomatics, really what we think when we think of the cheekbones. And again, there's variation from individual to another, but also racial variation. Background is seen on that. Nasal bones, really forming the bridge of the nose, but most of the nose is actually cartilage, as we saw last week. And then there's a bunch of smaller ones to know. I wanted to take a little bit of time to just point out a few structures from the mandible. So the main part of the mandible is going to be the body. We have an angle, which is really this corner that you often see, more pronounced typically on males than on females, but there's again variation. Ramus refers to this kind of a part where we're moving up towards where the attachment point to the skull is going to be present. And we are going to be having a condylar notch and coronoid process. And notch in between those. I do want to highlight here alveolar processes is where the roots of the teeth go. And we really see if a person loses teeth, because I used to teach dental students, if there's no teeth, this alveolar process portion of the jawbone disappears. So the face often looks like it's collapsed. So there is a need to do something about dentition if a patient loses those, so that they don't lose that bone mass from the jawbone as well. Another one that I wanted to mention about, we're moving away from the skull to the hyoid bone. Hyoid bone is one of the weird ones because it's one of the bones that's not attached directly to any other bones. So it's kind of held by a lot of soft tissues and connective tissue structures there that are not bony. It doesn't articulate with other bones located here inferior to the mandible at the neck. Really, the ligaments hold it on place. There is a forensic relevance that often breaks when when the victim is strangled, but it doesn't always break. So it's something we look, but it's not a definite one. There's different parts. Again, the main part is body, and then we have lesser and greater horn. Kind of quickly, I wanted to mention sinuses, and I typically revise the paranasal sinuses on BIO202 to a great detail, but within your skull, you have empty spaces, and these empty spaces are really named based on the bones where they are. So frontal sinus within the frontal bone, maxillary sinus within the maxillary bone, ethmoid and sphenoid sinus, sphenoid within the sphenoid bone. So these are empty spaces. Word sinus in language of anatomy is an empty space. And there's quite a few debates. Why do we have them? But I think that some of the better agreed explanations is that they reduce the weight of the skull. Otherwise, carrying the head up would be a lot of work. And they also might have things to do with voice resonance, forming the sound of your voice, potentially with also immune system. I wanted to mention quickly about the vertebral column. Vertebral column is really the running from the skull all the way to the pelvis, the function to kind of transmit the weight, a lot of things attached to the vertebral column. So it's where everything else seems to be hanging to. And obviously protecting the spinal cord that runs inside. I sometimes ask my students what kind of type of a bone vertebrae are made of. They are irregular bones from what you learned from last week. There are going to be 26 vertebrae for us. I typically divide them into 5 regions, so 7 cervical vertebrae, 12 thoracic, 5 lumbars. And then sacrum and coccyx, even though they start as separate bones, the bones of the sacrum and coccyx end up fusing together eventually. I'm thinking what else to say. Sometimes students remember the number of these different vertebrae by thinking of different times when they might eat. I don't know if you eat at 7 and midday and at 5, but some students find it useful. If that's a way that works for you, go for it. You do notice this curvature, and I offer more discussion about the curvature, why it matters, and how it develops in the full lecture video on the study materials. These are strengthened by ligaments, and we also have intervertebral discs between these bony structures, so there's no grinding against each other. These cushion-like pads really help with mobility. Bone against bone wouldn't give us a great mobility, but when we have these cushion-like pads, that gives us a lot of chance to move around. They also help with shock absorption. Truth is that in an adult patient, they will get squashed over the day. So you will be a little shorter at the end of the day than you were in the morning. We can have sometimes herniated discs, as we see here, disc bulging out due to typically physical trauma, and this might end up pressing spinal cord or spinal nerve, so that becomes a little more complex. I'm thinking of what else to say. I think that we're just going to keep going, and I want to highlight the few important parts of a typical vertebra. These do look very different depending on at what level we are at. But the main bulk here, we're looking from top to down. So the back side would be here, front would be here. The main bulk of a vertebra is going to be the body. The opening here that we see where the spinal cord runs is going to be our foramen. We have a spinous process coming out, and on the side we have our transverse processes on both sides. The bony part that connects here is going to be our lamina, and the pedicle on the more anterior aspect. Those words, really, it's just memorization, and you will end up seeing those on the full lecture video. I want to say a few words also about the thoracic gauge. Thorax, really, this is where the vertebrae of the thoracic region attached to. We end up seeing that really made of the ribs, the rib bones, and the sternum, the chest bone. But there are going to be also costal cartilage that plays important role. The functions really are protecting the vital organs such as heart, lungs, supporting upper limbs. We'll have a look of those in a bit, and their attachments. And really attachments point for many muscles that form the neck, back, chest, and shoulders. In terms of the sternum, I wanted to highlight few parts. So the largest part of the sternum, this middle part, is going to be the body. We have at the very top the manubrium. Manubrium is where your collarbone, your clavicle joins at the more proximal aspect. And most people have a small part at the very inferior part, which is known as our xiphoid process. And that's not fully ossified until you turn about 40 years old. There can be all sorts of weird clinical cases. If we had more time, I would speak about those where the xiphoid process, for example, points to the wrong direction and so on. That can become a problem. A few words that I wanted to say about the ribs. There's going to be 12 pairs. 7 of them are considered as true ribs because those ribs attach directly to the sternum. And then we have ribs 8 to 10, so 3 rib pairs that are considered as false ribs because they have this costal cartilage bundle through which they attach. And then we have 2 floating ribs, ribs 11 and 12 on each side. You could study ribs in a greater detail, and I provide that again on the full lecture videos. I want to mention a couple of appendicular skeleton things to notice. This is really the bones of the limbs and where they attach to the trunk. So we see pectoral girdle for the upper limb, so the shoulder region, and pelvic one for the lower limb. For the hip region. Let's start with the pectoral girdle. We'll end up seeing that that's made of the bones that are involved. It's going to be scapula, so your shoulder blade, your clavicle, so the collarbone, and then of course the head of the humerus, which is technically part of the upper limb. Really, this is the attachment point, attaching the upper limb and axial skeleton together. This is largely also important place for a lot of muscles to attach. What I would highlight here, that notice that the bony fit is not great. The ball is huge and the socket where it attaches is tiny. So it is giving us a huge range of movement, and it's held together by soft tissues. But this is why dislocations are so easy for the shoulder to happen. This is really the evolution explains this, because when we moved to the walking on 2 legs instead of 4, we needed this freedom for the upper limb so that we're able to manipulate objects and so on. Like I said, huge amount of mobility, but very, very poor stability. And you could revise different kinds of anatomical movements with the shoulder. A couple of words that I wanted to say about the scapula. So our shoulder blade, a really thin kind of a triangular flat bone, attaches to the rib cage on the dorsal side, between the ribs 2 and 7, and there's really 3 borders. So superiorly, this kind of a short and sharp border, the medially running along the plane of the spine, and then laterally going in an angle. So we have our superior angle, lateral angle, and inferior angle. Glenoid cavity was where the head of the humerus joins, so this is going to be called the part where the socket is, glenoid fossa, if you wish. You will see on the scapula a spine running, separating kind of the ridge on the posterior side. It separates the superior and that helps to separate with the side, separates the superior and posterior portion. You can see other bumps, the acromion and coracoid process, and the subscapular notch where some important nerves pass as well. I'm going to keep going just in the interest of time. I'm just really quickly wanting to mention the humerus. So the largest and longest bone of the upper limb. Parts to know, we do have a head at the proximal end that really articulated with the glenoid cavity. We also have these little bumps, and I think this side shows it better. We have a bigger bump, a lesser bump, so greater and lesser tubercle. And these are really where the muscles of the rotator cuff muscles join, and we'll see those next week. There is going to be an anatomical neck, and there's going to be surgical neck. The anatomical neck is really what separates the head part from the rest of the humerus, but surgical neck is what really surgeons have introduced, because this is where it normally fractures. So I think that we see that there's a lot of terminology to cover. There would be other things to notice, such as the deltoid tuberosity, where the deltoid muscle attaches. We see radial groove, and at the other end we will see things like trochlear and epicondyle and capitulum. So there's structures to revise. From the forearm, really, I want to point out how elbow is extremely complicated joint. There's actually 3 different bones that move all kind of very differently from each other. From these bones, ulna runs on the pinky side and radius runs on the thumb side. I often tell my students, think of it right on for radius, thumbs up there. Again, different parts to know there, and I'm gonna leave those in for the interest of time for you to have a look of yourself. Same for the radius. Really quickly, bones of the hand, you have your carpal bones, so 8 bones there: scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, and capitate and hamate. I don't expect you to know those by heart. And then we are going to see our metacarpals and phalanges. And especially we typically separate the pollex, the thumb, and then digits, the fingers 2 to 5 from those. I wanted to mention quickly about the hips, because I want to be mindful of the time. Hips really are made of the 3 different bones, and the sacrum. Sacrum, though, is part of the vertebral column structures that we revised. So we have our ilium, the most superior portion, ischium, the posterior and inferior portion, really where you sit, and then the pubic bone. This is the anterior part. Some student of mine once said this is where your pubes would be. From these, you could identify different parts. Again, the acetabulum is a good one, the socket where the femur joins, and so on. Pubic symphysis that joins the two sides together, separates during childbirth. Pubic angle, how these bones come together, really is used to separate the sexes between the skeletons, and so on. I do want to keep going. I want to point out in terms of the lower limb, our femur, the only bone of the thigh, the largest and strongest bone in the body. Again, we see the head, we see that articulated with the acetabulum of the hip. We see the neck, which is often fractured, greater trochanter and lesser trochanter, these major muscle attachment sites. And then we can see on the other end different condyles and and so on. Moving on, for the leg bar, we have tibia, which is the more medial, carries all of the weight really from the femur to the feet. And then we have our fibula, which is kind of lateral one and doesn't really carry weight significantly. And again, you could see different parts of these. From the feet, we do have our tarsal bones that help to form us our ankle, 7 bones there, metatarsals 5, and phalanges 14 bones in total that make the toes. Hallux is the big toe to notice there. That's really quick summary of the skeleton, and just few words about the joints. I know we're kind of running against the time, but I do want to mention few things. These articulations are sites where the bones come together and meet, forming the functions are kind of two-folded. That's really what allows us to move. So we're first learning skeleton, and then we move on to learn muscles, but you'll often see that muscles cross across the joints. So that's why we really need to know both of these systems to be able to understand movements. But in addition, really joints are important for holding these skeletons together. And there's many different ways to classify based on the structure or based on the function. I'm not going to go into great detail, but I'll mention quickly from the structural classification, the fibrous joints. These are joints that don't really move. There's fibrous connective tissue that connects the bones that are in really close contact. We would see these, for example, the sutures of the skull that are really rigid and interlocking. Syndesmosis refer to those bands of tissue connecting two bones, like we saw, for example, with the tibia and fibula. There's a band of connective tissue that connects those, or interosseous membranes would be also a good example. In terms of the gymphosis, these are like really back in a socket types of joints. Think of the teeth going to the jawbone, the roots there. In terms of the cartilages, this is really where the two bones come together, no really joint cavity present, and are really immobile. There's a little amount of movement though. So we see these in places like growth plate, pubic symphysis, where the two sides of the hips join together, and costal cartilages would be good ones on the rib cage. Finally, synovial joint. I know we're pushed for the time, but I really think that these are the important ones. These are really the free-moving, most complex joints, and typically I would draw it with my students. If anyone needs to be going, I totally understand. But I will really quickly sketch the important parts, and you'll be able to find the full drawing in your learning materials, but I'd want to at least point out. So in synovial joints, we have two bone ends that come together, and typically we end up finding an articular cartilage at the ends of these bones. So typically the bone ends don't bone act on bone. There's this cartilage that rather interact with each other. This really is typically hyaline cartilage, and covers the ends of the bones, facilitates the smooth flowing of these ends. What else do we see in synovial joints? We do often see, or we do always see, a joint capsule. So this is really the actual synovial cavity, that the actual space that gets formed. We can also see the joint cavity inside the space there. In terms of the joint capsule, going back really quickly, there's typically a fibrous layer and synovial membrane layer. And again, a full lecture video goes into greater detail about that. I do want to point out that this synovial space, synovial cavity, is typically filled with synovial fluid, and synovial fluid serves two purposes. It lubricates these parts, but it also kind of nourishes structures that don't have direct blood supply that are located in this area. What else could I highlight from here? I guess I could highlight various different kinds of ligaments that strengthen these structures, so adding to that, reinforcing it. And we are going to see a lot of different kinds of nerves and blood vessels also on this region, kind of helping us to detect the body position, the stretch, also carry nutrients, gases, waste products, all that kind of stuff. So those are to be noted there. I would add, sometimes we see in some synovial joints, so there's a lot of variation, and this is kind of a general one, we might see fat pads as well, providing a little bit of cushioning within the structure. Often in synovial joint, you will end up seeing also this kind of an articular disc in between these two bone ends that come together that is called menisci. It really improves this fit and stabilizes this structure and reduces wear and tear. You sometimes do see, I'm going to add it for the sake of completeness, but I don't know if it's really super important, these bags of synovial fluid within the joint capsule itself. These are known as bursae. They reduce a little bit of friction. So a lot going on in synovial joint. These are the most important joints. We also have other ways of classifying the joints, and there's so much to cover that we won't go into detail. But again, you will be able to revise those. So for example, ball and socket joints provide usually a good fit and a large range of movement. In terms of hinge joints, these are like door hinges. You can think of, for example, how they work, how these joints bend. If we talk about pivot joints, these are really where the end hold still and rotate. I think a wrist is a really good example of that. We have our gliding condylar and saddle joints. So condylar, one good example of that, for example, the oval socket, that's kind of, it's an oval, it's not quite a ball and socket, but it's close. And like I was thinking of the saddle joint, this sits and fits well, but doesn't have unlimited range of movement, only allows movement to a certain direction. Really, that was the quick review of the chapter material. I do want to come back to this and just check whether anyone really feels strongly, do you want to go through the homework assignments? I know that we're at the kind of a full time. I'm happy to look at those, but I really think that there's nothing new, nothing shocking that you wouldn't have seen before. If you read the textbook, use that to guide, use the notes. Like I said, really it's the quizzes and it's the practice anatomies that I build my exams and practicals from. So really what the work you do with each chapter is preparing also for the exam. Does anyone have anything urgent, burning that you want to address, you want to ask that comes to your mind? Feel free to do so. Like I said, I will upload those blank diagrams if they're not there already. Like I said, I do appreciate the feedback, so I try to make improvements as I get more of that. I am here to help. I really want you to succeed. If you don't have anything, that's it for today. I will stick around for anyone who might want to share or stay and chat behind. But this is it for today. Thank you. Have a good night.
Thank you. You too.
Thanks. And I'm totally happy to stop recording if anyone has anything afterwards. So, on that note, this really wraps up everything I had planned for today. I hope that it was useful. Like I said, it is a really short time to go through everything, so you do always have the access to the full material on the full lecture videos. These are really the nutshell versions. Like I mentioned earlier on, I've spent a great amount of time and effort on trying to make sure that I'm offering as many responses to the feedback that I've received. So if you do want to go into further detail, I do think that those study guides and those want more materials are going to be useful. Don't hesitate to submit them for me. I will be gladly looking at those and providing feedback. And again, I kind of echo that what I said earlier on, that a little bit of the studying has to be also student driven. It can't be just me driven. So for the discussions, if you choose to use those, I can't force you to use those, but if you choose to use those, you probably are going to have great and meaningful discussions. But at this point, I would feel unfair changing the format and making it a required assignment. So they are optional resources where really help yourself to make it worth. On that note, that's all I have for tonight. I hope you have a good week. Remember, I'm here to help you every step of the way. So all you have to do is reach out to me, and I'm always available through the Canvas messages during the office hours or during these live online sessions. Have a very good week, and I look forward to receiving more midterm feedback.